same faces in the previous video.
Sly?
We are here again. It's Shioma again. I hope you subscribe to the channel, like she said.
Have you guys subscribed? I will look for you.
I want to see your comments saying, subscribe to my Nigerian sister. You know how we and Nigerians are like number 9 and 10. We are like, even though we are their big brothers, they know that for sure.
No. Okay.
Okay. So Shioma, thank you for coming once again on Campus Light TV. This one, we are going straight to the point. I just want to know about the work. Like, I don't want to tailor it purposely for it, but I want a range of people to get this.
Yeah.
What type of job do you do?
I work as an healthcare assistant. People know it as nursing assistant. Yeah.
That is it. I want you to brief us. Like, is it like the nurse in Africa? Like when you say somebody is a nurse or a nurse in Africa, is it the same?
Yeah, like, you know, in Nigeria, I think they call it medical aid.
Okay.
This job, you're not doing anything really pertaining to, you're not really handling the patient directly.
Okay.
You are there to assist the nurse.
Okay, like how? That's what I want to know. Like, how are you assisting them if you're not doing it?
Okay.
Like, give me this or...
No, not really like give me this. Like, you know, the nurse is in charge of the patient.
Okay.
While you may be, depending on your department where you are actually working, but let's talk about the hospital settings. Like, for example, they want to turn a patient, you need you to help them turn a patient. There are some simplified things that you would need.
You don't go into detail like the medical.
Yeah, like giving, like prescribing medication. You're not allowed to do that. Like to give injection, you're not allowed to do
I
that.
just want you to say it so that people at home, they will feel like, okay, this is a good opportunity. I would like to do this because a lot of female watch my channel. They're like, you don't do content for ladies. So I know, is it only for ladies? The healthcare?
No.
Okay, so, but I want us to focus. I want us to focus on the ladies. Like you said, you can tell the patient. The nurse can tell you, okay, at this time, make sure he take this medication. Did they say stuff like that?
Yeah, but in my own organization, when it comes,
I don't want to talk about
we're talking about Qatar.
Okay. Oh, okay.
We're talking about Qatar.
Okay.
Most hospitals in Qatar, they don't allow nursing assistants to be in charge of anything medication.
Okay.
They don't allow it.
Okay.
Okay, let me take for example, I worked as a swabber. Okay, this thing is what you can, if they teach you, you can know how to do it.
Okay.
But a nurse cannot. You cannot really bring a nurse down like that to really
What is
swab.
a swab?
Like during the COVID-19, we had people swabbing.
Okay.
So most of those people swabbing, they are nursing assistants. They are just to like assist. I don't know if I'm going to really expatiate this, but you are not
like if you're able to tell us the roles, the particular things.
That's why I said
not you per se, but maybe your department or the other department, what they do. Like I want a layman to understand that okay, when you say this, she's not a nurse, this is what she does, this is what she does. Like you said, it's assistant. We know who an assistant is. But
that's what I'm trying to tell you, is you assist the nurse. Okay? But me, I can only talk from where I have worked, from my own department. Because they have there's a different section. But I think everything is just like you are assisting. But you're not dealing directly with the patient, like the medications and everything, you are not. But okay, now let's break it down. There's a difference between caregivers and nursing assistants. There's a huge
now you are coming out.
Okay. There's a huge difference, guys. Like for example, as a caregiver, you have to work most of the time. You work in the homes of those patients. They'll train you that maybe there's a patient that cannot really move. The patient is bedbound, but this patient's condition is not really critical.
Okay.
Then they're going to need a caregiver to care for that patient, to wait for that patient. Okay? Some people might call it nursing assistant, but that work is not a nursing assistant job.
This is the difference.
That is for caregivers.
Okay.
But nursing assistant is it's much more professional. But I'm talking from my own.
Yeah, that's what you're on the right track.
I'm talking from my own business because in a different country it might be different. You might call it a caregiver. For me, I don't see my work as a caregiver profession. We are all giving care to patients. But caregivers here is different.
Okay.
So a nursing assistant, you are just there to like assist the nurse. Like maybe you want to impute something in the system to turn the patient in the hospital and everything. But caregivers, they are actually.
Now you are saying some of the things that you put something in the system. These are the things I wanted you to talk about. I'm talking about the roles, what you do.
Yeah.
But yeah, that's it. So you've already explained that. I'm cool, and I believe you guys are also getting it. I want to know what are some of the courses you do to be able to be at this position.
Okay. In Qatar here, okay, for you to be a nursing assistant, most of the criteria, if they are bringing you from your country over to Qatar, we have nurses that they have not done the years gap. Okay, let's bring it down. If you are coming to Qatar, if you want to come to Qatar as a nurse, at least you should have 2 years clinical experience. And that 2 years clinical experience, there should not be gap.
When you say gap, what does it mean?
Like maybe for example, you work 1 year, you did not work 1 year, then you work the other year. No, there is gap. So when they talk about 2 years clinical experience, you have to work straight clinical experience straight.
Minimum 2 years. Minimum
2 years for you to be a nurse in Qatar. Okay, so there are some nurses that maybe they had a break. Or maybe there's people that have nursing background, but they did not really practice it. Those people, yeah, they can get the job as a nursing assistant.
So let me say, if somebody completes nursing school in Ghana or Nigeria, they can work here directly as a nurse. Maybe let's say they've worked for 5-10 years, they can work here as a nurse.
Yeah.
Without doing any top up or anything.
If they have worked as a nurse,
a full-fresh nurse.
As a full-fresh nurse in Qatar, you must have worked in your country, and also your country's nursing license, you must have it.
Okay.
So when you have
that's what you need. You need
if you want to work as a nurse in Qatar, at least it can be more than, but at least 2 years clinical experience, no gap, and your country's nursing license. So any company that is bringing you over to Qatar, you need to do prometrics. So your prometric, I think the nurse.
These are the things I don't know, but you are a nurse watching this.
You know that.
Know, yeah.
You know that definitely. So you have to do your prometrics, and your prometrics most of the time you have some of the companies to bring you over to Qatar to do that prometrics. So they will be the one to register you so that you can get your license.
An international prometrics you are talking about where you can do it. Maybe it's a UK accredited one. So when you get here, you don't need to.
For that prometrics, I don't really have an idea about it. Yeah.
Okay.
But just Google about prometrics. Maybe you can do it from your.
But how do they get a job? Like you said, the company. How are companies able to recruit people like this from Nigeria? You didn't come directly as a nursing assistant, so, but I'm saying if somebody is a nurse in Nigeria and want to come here or in Ghana want to come here, how is it?
I just believe that's why Google is our friend.
They should Google it.
Yeah, because I'm not telling guys to Google it. I don't want to sound it, okay?
No, it's not rude. I mean, we should put some humor into
I said that's why Google is always our friend, okay? These things you can easily go online and search, but there are lots of agencies, nursing agencies in Qatar.
Okay.
I must tell you, there are lots of it. Like I'll mention one, just one. Doha Care Services. You guys can go on their website. Once you meet up to this criteria, go on their website and send your CV to them. Yeah, they are really looking for nurses in Qatar.
Really?
Yeah.
Doha Care Service. They said they are looking for nurses.
I'm going to be doing a video. That's why you need to subscribe to my channel. I'm going to be doing a video on how to be a nurse.
I don't do much of this cheat right now. I'm going to recommend it because I know nurses. I'll let them subscribe to the channel so that they will do more of this.
I'm going to be doing a video on that, and I'm going to be stating some agencies. But why I'm
stating, doesn't want to give us.
No, why I'm stating Doha, I know about 13 agencies. Why I'm stating Doha Care is that I have taken permission from them, because I cannot just start mentioning agencies. I've taken permission from them. They said yes, I can mention it on YouTube. So once I am done calling all the agencies and they agree, I'm going to post it on my channel so you guys can as well start applying. And you can only, it's not about nursing, you can apply as a nursing assistant. That's why I'm saying that if you have like gap in your nursing experience, you can apply as a nursing assistant. Yeah, but the but is there. Let's come to the salary aspect.
Yeah, very important.
The way the government, I just want to break it down so that you don't expect so much. The way the government, if it's the government hospital here in Qatar, is bringing you, the way they're going to pay you is going to be different. Those agencies, they might pay you a little bit less, but just note that they are paying you, they are going to provide you your accommodation and your transportation. So if you are to, I don't really know about that.
I mean, food is not really expensive.
But if you are to round that up, you know the way accommodation is now in Qatar, and transportation, you know how it is. So if you are to round that up, you are earning more. They're just paying you for you to save and feed yourself. So just have that at the back of your mind. Don't just expect too much. But you can as well try applying to the government hospital. Never seen them. Okay, search for the government hospital. Go there. Government hospital in Qatar.
I know. I will say it. It's Hamad Hospital. It's the biggest hospital over here.
So if you're going there, search and as well try your luck. Yeah. They also need. I think they'll need people. But just send your CV randomly.
Yeah, send your CV.
And hopefully you get it.
Try it. They'll bring you. You'll be surprised that you don't pay anything. They'll just recruit you.
Nurses in Qatar is really needed.
And if you are a nurse or if you have the aspiration, the zeal you want to be, please subscribe to her channel because she's going to do more of that on her channel for the ladies. So that's about it. So what are some of the things they should be prepared for if you want to come here as a nursing assistant or in the health sector? What are
mine is just get prepared to learn, because the way we are doing things back home is way more different here. The system, the way we impute things, and here is much more advanced because I think they're using the American
system.
Yeah, the American system. So it's much more advanced. So just open your mind to learn. Don't believe that the way you are doing it back home, that's the way you're going to do it here.
How many hours do they work?
Most times, let's say in the government hospitals, most nurses they work 8 hours.
8 hours.
But for the agencies, they pay overtime too, depending on your department. So don't think some departments will tell you that no, okay, there's no overtime. There's some departments naturally there's no overtime. You work your 8 hours, you go. But there are some for the agencies, I think 12 hours.
Do you have age limit?
I think 50.
50.
Yeah, it must not be
above
50.
Maximum 50. And apart from that, they don't have weight, size, height, anything like that?
No, your skin color does not matter, your size does not matter. It's just what you have to offer.
It's your brain
that matters. Yeah.
Thank you so much. Now we've known if you want to go into the health sector. We've talked for ladies because she's a lady and I've done so much for the guys.
Not only for ladies, though.
I know.
Even the men can apply as a nurse.
But I said that's what I was about to say, that we've talked mostly about ladies, but if you're a guy over there, what we talked about, you can apply it to your own self because it's not only for ladies.
Yeah.
I just decided to do this one for the ladies. But
for my ladies.
Yes. So thank you so much. Do you have female nurses from different countries in your company, right?
Different. All nationalities.
So you guys coexist, there's no...
Yeah, and you have to learn also if you're coming to Qatar as a nurse, or maybe not even a nurse, you also have to learn how to coexist with other people. Yeah, because you're not going to be seeing your own nationality. Like for example, me, in my own department, we're only 2 Nigerians there, other nationalities there. So we just have to flow with ourselves here.
Alright, so this is for the health sector. Thank you so much, guys. Kindly subscribe to my YouTube channel. First of all, subscribe to the channel.
Please subscribe to my channel, okay? The information I dropped now is...
You see, she was keeping this thing for her channel.
I was keeping it.
I dragged it from her back. So guys, please, for dragging that, kindly subscribe to the YouTube channel. And thank you so much. Subscribe to mine as well. Follow me on all social media at Kama_Sly_TV everywhere. Kama Sly TV.
What's up, Sly?
Bye.